most of the time, our brain uses glucose, but there will be times where we are low on glucose. For example, when we are fasting on when we are on ketogenic diet. So in that moment, the brain cannot access any of this glucose and it cannot access any of the fats. So in order to provide the brain with the energy source that it needs, it the fats need to then get broken down into ketones. And ketones are smaller molecules, so therefore they can get past brain barrier and provide the brain with energy. And that's when you get the mental clarity. That's when you get the physical performance. They can go out and hunt and really focus on, survival.
So, Lat,
Yes.
it's so great to have you on this podcast, and I have to say I've been so looking forward to this because let me just tell you, anything to do with health optimization, brain clarity, and just performing at your best, I'm an absolute sucker for it. I know that a lot of people are, but I'm an absolute sucker, and I think it's because since having two kids, you know, I think like for a lot of women, my health, I could feel that I was human. Like, when you're young and you feel like you're invincible, but then after having kids, I could feel that, my brain function wasn't as good. I was getting brain fog. I was getting this, the afternoon slumps that everyone talked about. And I was like, what are you talking about? I never get that.
Yeah.
I started to get those. And so basically ever since then, like for years now, for about 6 years, I've been really fascinated by the idea of like health optimization. How do we get better? How do we think better? How do we stay young as our body ages? And so the topic of ketones and ketosis is so on the pulse of everything to do with performance and kind of longevity. So I was so looking forward to speaking to you, and I'm so glad that you're here, like in between your travels. So I just my first question to you is basically, you've already, before we started, you already kind of told me your story a bit, but how did you get started in studying metabolism and ketones, and how did Ketone IQ come about?
Yeah, sure. It's funny you mentioned, you feel all these symptoms after you have kids. It's almost like evolution tells you that you just need to procreate and produce offsprings, and then as you produce it, you just give all your resources to them,
That's
and
right.
and then nothing left for you. But in this day and age, we all want to live forever and live young forever. And I don't know whether we even pressed record earlier when we were asking each other's age, and we're the same age, and we're turning
Yes.
40 this year, and
You
looking
August, me
great.
September.
Yeah, exactly. A month apart, literally a month apart.
Yeah.
So, and as I was saying earlier, I think why I got into physiology and metabolism was more so due to my own sort of upbringing and my own family background. Because growing up, I have always been an overweight kid, and I've been overweight all my life until in my second year of undergrad, where I was 22. And that was when I started exercising. I started jogging. In fact, I didn't exercise because I wanted to. I didn't exercise because I wanted to lose weight either. I
Mm.
exercised because I was dragged to go for a jog by my housemate, Leanne, at that time, because she wanted to go for a jog. And I was like, sure. And I did it, and I went blue, and she panicked because I looked like I was going to pass out and die. And, and that was a very embarrassing
Not
moment
great
for
for your
me.
20s.
It was quite eye-opening because really showed me how unhealthy I was. I was eating unhealthy. I was a smoker then as well,
Mhm.
and I was definitely not exercising enough anywhere enough. And one of the times that I went jogging as well, there was an old couple who was like maybe in their 60s, 70s. They were running faster ahead of me and they were cheering me on. And that was the most embarrassing experience ever. And I literally told myself, I'm like, I cannot like, I am 22. I cannot go through life feeling and looking like this. So I kept jogging and kept running. It was like a 2 kilometer run. So it's not a big run, but I couldn't even finish it. It was around the lake in the university campus. And I lived right next to it. So I would go out, of my house and run around the lake and come back. And that's around 2 kilometers. And I would do that every day, almost every day. throughout that summer in my second year, when everyone went home for holiday and I stayed back and worked in this local cinema because I needed money, and after work I would go for a run, and I couldn't finish the run in the beginning, but then I would tell myself, I'll look at the next tree as my next goal, one step at a time, and then eventually I managed to do the whole lap, which I was like, oh my God, I would never thought I could.
And
And
how
also
how far
during
is the whole lap? Do you
two
know?
kilometers.
2 kilometers.
Yeah, it's
Wow.
not even far. That's what I'm saying. Now I can say it. But before I was like, oh my God, that's a track. And I also gave up smoking at the end of that summer as well, because I realized on days that I don't smoke or I smoke less, I could run further without having to fight for my life. So that really changed my life. I lost about 20 kilos, about 45 pounds in like 4 months. I gave up smoking. But at that point, I was I lost too much weight too quickly. So I almost look unhealthy because I didn't put on any muscle because I didn't incorporate strength exercise.
Mhm.
And I didn't know anything about strength exercise. Only in the final year, in my third year, in the beginning, that I joined the gym and I started learning about strength training. I'm like, I still remember the first time I went to the gym. I'm like, what are these machines? I'm like, how do I do this? Like, I have no idea. Push
It's
this, pull this.
frightening. Yeah, it's
It's
frightening when you
frightening.
go in.
Um,
Yeah.
the lucky part is that it's a university gym, so it's not as terrifying as a commercial, I would say,
Mm.
a gym like in the US especially. It's big,
Yeah.
warehouse gyms, and everyone's like three times my size.
Right,
But
right.
in the UK, it was a university gym, so everyone was friendly, and they taught me how to do all of that. So that, I was doing biotechnology and I was studying a lot around physiology. And my final year project for my undergraduate was the metabolism of adipose tissue. So adipose tissue is fat tissue. I have to create a mathematical model of fat tissue metabolism. And a lot of my friends thought I used myself as a subject. I was like, no, I didn't. It just happened that I started exercising and lose weight. I studied all of that and I found that very fascinating. And then I went on and did a master's also in biotechnology, but that was very much focused on drug regulatory and clinical trials and learning how drugs are being discovered to, getting the approval, getting treating patients and all of that. So that was my master's. And then I worked in a pharmaceutical company that specializes in cardiovascular medicine. So at that point, obviously, my dad passed away when I was 17, right before I entered my first year in university and undergrad, and he passed away from a stroke, and he had a heart attack a few years prior to that, and had an open heart surgery. So cardiovascular medicine has always been something, I have been interested in because I know it is hereditary as well. So I am at risk of developing that. And given my, background of like being overweight and all that, that also increases the risk of cardiovascular disease. And then after 1 year working for the pharmaceutical company, I decided to apply for my PhD because I was inspired by people who were working in that company because they were so clever, they were so intelligent, they were all scientists, they all have doctorates, but they're also very, very entrepreneurial. They are applying what they learn in real world and helping real people better their lives. So I decided to apply for a PhD at Oxford, specifically looking at diabetes and cardiovascular disease. So my entire thesis, my entire PhD was in learning about the metabolism of a type 2 diabetic heart in hypoxia, which is low oxygen environment. I use the term hypoxia or use the condition as a subset of ischemia, which is ischemia is a lack of blood flow. So when people have a blockage in the artery, they are having ischemia, and then that could lead to myocardial infarction, which is heart attack. So that was my journey. And then I got into ketones because ketone is also part of the metabolites that's being produced. And in diabetes, it's also very common when, like maybe 10 years ago, ketones were known as like the bad thing, the bad side byproduct, right? Because people talk about ketone as like a diabetic ketoacidosis, which is a a very, very dangerous condition in diabetic patients where they can die because of the elevated amount of ketones in their body. But the mechanism at which they are producing ketones is very different because they are producing ketones although they have very high level of glucose. So the body is starving itself because of the severe insulin resistance that they are experiencing. So they keep churning out ketones thinking that that would give energy, but their cells are just not taking in the substrates to create energy. So that's very different to creating ketones naturally when you're on a keto diet or if you're intermittent fasting. And then I got introduced to HVMN in 2019 when they got a $6 million grant from the military looking at the use of exogenous ketones to improve cognitive and physical performance. So I was spearheading that project and overseeing the entire project until we finished and delivered all the results about a year and a half ago now. That lasted 4 years and a half. And now I'm at Ketone IQ, basically overseeing all of our collaborations with clinicians, universities, research institutions, and really trying to put out as much education and information as possible so that people can do their own research and also make their own informed decisions.
And you really are, you're really putting yourself out there. And, it's not hard to find content from you, talking about ketones and metabolism. And, and you're so right. You said so many things just there that was so powerful. So, first of all, talking about metabolism and about, diabetes and stroke and heart disease. And it's such they're so widespread.
Yeah.
And the main cause of death, right? I think heart disease is the main cause of death
Yeah.
in at
Number
least
one
the
killer.
US.
Yeah.
Yeah. And it's all to do with metabolism, like a faulty metabolism. So really there's a metabolism issue out there. And knowing how to avoid it and combat it like you are, like you had it in your genes and you also were overweight, but now you're kind of fighting it. People need to know how to do that because it's so, it's not easy, but it's very simple. It's very
Yeah.
simple way to do it. So, and also, I'm really glad that you mentioned the ketoacidosis because whenever you type in ketones online and ketosis, a standard website would kind of explain what ketones are, but then they'd always give a caveat like,
Yeah.
oh, but by the way,
Yeah.
you can get ketoacidosis, and it'll kind of go
Exactly.
into it like
Yeah.
everyone can get ketoacidosis when really it's just for the diabetics.
Correct.
Type 1, right?
Yes.
Type 1 only,
Mainly
not
type
type
1.
2. Right.
Type 2 could, if their insulin resistance is really, really severe, I think.
Okay,
They were
right.
cases before.
But mostly it's just type 1
There we go.
diabetics. So it's just and so it's just nice to kind of shine a positive light on ketones, which you're doing out there, which is great. So can you explain what the hell ketones are then? Because they're so fascinating. Um, Anybody listening who is interested in ketosis and wants to, know more about ketones, is it safe? What shall I do? So first of all, go into how ketones are generated by the body and then how that leads to ketosis.
Yeah, that's a great question, and that's usually how I would start the conversation too. So this is great. So ketones are not a novel molecule. It is not a new drug like
Mm,
Ozempic that will solve everyone's problem. It is
mm,
a molecule as ancient as fat molecules are. It is as far as, evolution is concerned, the first organism that can metabolize fat, they probably can also produce ketone and metabolize ketones because it is derived from fat. And why do we need to create ketones? So most of the time, our brain uses glucose, but there will be times where we are low on glucose. For example, when we are fasting or when we are on ketogenic diet, that's the modern time. But if we think about our hunter-gatherer ancestors, we do not have, well, they did not have storage for foods. So they would go out and hunt, they'll get food, they get fed, and then there'll be time when they have to go out and hunt again. And at that time, they are probably low on glucose stores within their bodies as well because the foods are done, right? And they've already used up and they already metabolized it or they stored it into fats. So in that moment, the brain cannot access any of this glucose, and it cannot access any of the fats. Even though our muscles are more than readily able to metabolize fats, the brain cannot, because fats cannot bypass the blood-brain barrier. So blood-brain barrier is this thin layer of cell that filters bigger molecules to inhibit them from getting into the brain. So fatty acids or fatty acid molecules are one of those that cannot get past that barrier. So in order to provide the brain with the energy source that it needs, the fats need to then get broken down into ketones. And ketones are smaller molecules, so therefore they can get past brain barrier and provide the brain with energy. And that's when you get the mental clarity, that's when you get the physical performance. They can go out and hunt and really focus on, survival. And then jump to modern day. The reason why most people are not in ketosis, and by the way, the ketosis is a term to describe when our blood ketones are greater than 0.5 millimolar. So the way you do that, the way that you measure that is by pricking your finger, looking at your blood ketone levels via a blood ketone meter. So most people do not spend their time in ketosis. The reason being the abundance of food. Because when you have glucose in your body, you have increased insulin. And when you have insulin in your body, insulin is a hormone that basically encourages storage. It is a building up sort of hormone. It's a building hormone where it's telling your body that, okay, you just ate food. You've got all these, building blocks that you just inserted into your body. So let's pull them in to the cells, either metabolize them or store them if you don't need them. So when insulin is available, it is giving signal to your body that you have energy, and therefore it will shut down ketones production in the liver. Because like I said earlier, only when your glucose is low, because then your insulin would be downregulated, only then your body will kick into the ketogenesis, which is the production of ketone process, in order to take over the need of glucose and provide ketones to the rest of your body.
Mhm.
So that's essentially what ketone is in a nutshell. And it is a very nicely programmed process that complements the fed and fasted state of humans and most organisms, because they'll have period of time where they're fed and they have eaten food, and there will be period of time where they have to go out hunting while being hungry. But you can't just, collapse and get fatigued because you're low on sugar. So that's where ketone comes in.
So are you saying that humans in the ancient times, they'd be in ketosis more than we are now because we have so much
Absolutely.
access to carbohydrates and, so much
Absolutely.
food, right?
I would
Yeah.
definitely say that, yes. But
Yeah.
that doesn't mean that you need to be in ketosis 24/7. There's a
Yeah.
reason why the body designed itself so that when you're fed, you are not in ketosis, because you can use the other substrates. And when you're not fed, you are in ketosis, because then you can use that. And that's also why we, as a company, Ketone IQ, come up with the ketone supplementation, because then it will allow people in the modern time where food is abundant, where glucose is abundant, they can
Mhm.
still have access to the ketone regardless of the diet that they're on.
Right. So I have tried the keto diet. I've tried the carnivore diet in the past. I love my carbs though, so I kind of flip between them. But when I go to test whether I'm in ketosis or not, what are the best ways to test it? Because I use the urine strips because they're cheap and they're easy to get. That you can just get them from the pharmacy.
Yeah.
But you said blood is probably the best way to test it.
Blood is probably the best way, because the blood tests specifically blood BHB, which is beta hydroxybutyrate. And beta hydroxybutyrate is the form of ketone that is the most stable, that is being transported around the body in your blood and being metabolized as well. There are three types or three forms of ketones in our bodies. There is beta hydroxybutyrate, which is what I just mentioned, acetone, which is what comes out in your breath. So a
Mhm.
lot of breath meter would measure acetone, and acetoacetate, which is what comes out of urine. So what you're testing is acetoacetate. Now, the problem with acetone and acetoacetate is that as you are more keto adapted, your body will tend to maintain the form of beta hydroxybutyrate more often, which
Mm.
means it will create less acetoacetate and less acetone. So a lot of these people, they're like, well, why is my ketone levels, quote unquote, ketone levels lower than when I started? It is not actually lower. It's just your body is more keto adapted and you're producing more BHB, which is better for your body because your body actually uses BHB rather than excreting it as acetone in your breath or as acetoacetate in your urine.
Right, so the urine test strip's not the best for, especially if you're doing it long term.
Yeah.
But can I ask about genders then? So males and females, because when I think I was doing the carnivore diet for about, oh God, I was doing it for about 5 to 6 weeks,
Okay.
and I was still only zero point 0.5 to 1
Oh,
millimoles.
wow. Okay.
So I just wanted to know, is that a female thing? Is that a urine test strip thing? Or I don't know. Do you find that the women find it more
It
difficult to get
it could
into?
be it could be combination.
Hmm.
It could be the urine test strip thing, and some people just can't get it up there. Like I have been on
Hmm.
a keto diet before, and it wouldn't go more than 1.2.
Really? That's
Yeah, for like two
interesting.
months. So some people are just much better at producing ketones. And also, like, if you don't have a high level of ketones, there's always the argument is, am I not producing enough ketones, or am I metabolizing ketones so well that I don't have enough in the blood?
That's what I was thinking. I was like, I must be really good at this though. Like my body must be really good at metabolizing
Exactly. We
ketones. So
all
that
we
was my
all want
excuse.
that positive, yeah.
Yes.
But to be fair, there is one paper that looked at ketogenic diet between genders, and they found that postmenopausal women behave metabolically more similar to men compared to premenopausal women. So I believe premenopausal women were more resilient against keto diet and producing
Mhm.
ketones. I don't know why that is. I don't know what the mechanism of action that is driving that, but it could be something to do with hormones. It could be something to do with um, them really preserving the fat content because women generally have higher body fat, for multiple reasons for their hormones and all the synthesis and for their organs. So they are trying to preserve the fat and not break it down into ketones, whereas guys, or males they tend to, burn whatever they eat and get, more muscles or prioritize non-fat tissues.
So just say one person is, has you know, a standard diet, in your case, in where you are, standard American diet.
Oh God.
Let's
That's a good
let's
start.
let's say lots of carbohydrates and sugars and so on. So that person is burning a lot of glucose for energy,
Yeah.
basically.
Yeah.
But then someone who is, let's say, fasting or on a keto diet, their glucose is low. So they're dipping into their ketone, like they're starting to burn ketones for fuel. What is okay, so setting aside the fact that standard American diet foods and even the food in the UK is not great either, like standard. Um, okay, putting aside the toxins and the sugars and all the inflammation and everything, why
What do you
is
mean not healthy? Little deep fried, fish and chips or some bangers and mash.
like that's like our dish, like the
I
UK
know.
dish. That's our main dish.
The good old English
Right.
breakfast.
Oh God, don't even get me started. But what is are ketones superior in terms of the body using ketones for energy rather than glucose? Like, is it better to use ketones? Do you get better results, better energy?
Great question. There was a paper in 1995 by Sato et al. If you search Sato 1995 ketones, you should be able to find this paper. They basically showed that ketones are being metabolized in a more efficient way than glucose. So there is more, like, per oxygen molecule used, ketones can produce more ATP. So in that sense, it is a more efficient fuel. But then again, I have not seen a study that replicated that study since 1995. So I would love to see a replication of that study, or even like go further and understand why is ketone a more efficient fuel. In some tracing studies as well, where they trace where the substrates go, when they're being injected beta hydroxybutyrate, it does show that it's being taken up by, the heart and the brain and very rapidly. And even when they measured in heart failure models, whenever ketones are available, the heart will take up ketones independent of other substrates, meaning that the other substrate will still go in, like glucose and fats will still being taken up, but ketones will get a preferential treatment and get taken up on top of that. So essentially, you're providing more, and this is a failing heart model. So you are providing more energy to the failing heart, which is essential for survival.
I heard somewhere, I'm going to absolutely batter this, but I heard somewhere that when your body burns glucose and when your body burns ketones for fuel, the byproducts are a lot cleaner. I'm putting that in quotes for when you burn ketones than when you burn glucose. Like if they said it was like a car exhaust, it's like with when you're burning glucose, it's like a petrol car. But then when you burn ketones, it's like an electric. It's like
Yeah.
clean and it's,
Depending on what byproduct they mean. Because
okay.
if you look at metabolism, if you look at how, just the standard glucose pathway and then fatty acid oxidation pathway and in the mitochondria, if you search, metabolism in mitochondria, you find out that they both glucose and fatty acid oxidation converge on the Krebs cycle in the
Hmm.
mitochondria. And the Krebs cycle then creates all these intermediates that again feeds into the electron transport chain that creates ATP. Okay. So they all sort of converges. So I
Hmm.
don't
Into
see
the same
why,
pathway.
yeah, so I don't see why the ketone would be cleaner in that way than
Yeah.
glucose, unless they name a specific byproduct that I can identify.
Yeah.
But so far, my understanding is that just from efficiency point of view, ketones can, uh, you know, need a little bit less oxygen to create the same amount of ATP or a little bit better. And it feeds back into the acetyl CoA within the Krebs cycle, and glucose will go down glycolysis, and then will convert pyruvate into acetyl CoA and go into the Krebs cycle in the same position as well. So that's my understanding of metabolism and ATP generation. So
Mm. So if someone is metabolically unhealthy, would they find it difficult to get into ketosis? And is that the whole point of getting into ketosis so that you become more metabolically flexible, they say?
yeah, so I would definitely associate metabolically unhealthy with metabolically inflexible, because as we know, our bodies are programmed and is a very smart tool, right, that we have. It is so smart that it switches back and forth to whatever substrates that we need that is most ideal and most efficient depending on what we're doing at the moment. If
Mm.
we are sprinting, we will switch over to glucose because glucose can produce ATP or energy without oxygen within the first pathway, which is glycolysis. But if we are doing endurance exercise, we're doing cardio zone 2, we'll be burning more fat because we have time to get the oxygen in, and fat will have more energy because it's a longer chain and it provides more ATP as you break down those carbons within those chains. So in that sense, that is metabolic flexibility. It's the ability to switch fuels, to switch metabolism depending on the situation. But for people who are over reliant on carbohydrates, on fats, one or the other is not good, because then you are forcing your body to burn something even when it's not there, or even when the resources are limited. For example, if you're over reliant on fat and you have lack of oxygen, you need to switch over to glucose. But if you're not able to, then you start creating oxidative damage within the cell because you're still trying to burn the fat. Either you are producing oxidative damage directly as the dysfunction of the mitochondria, or you're not producing enough ATP or energy, in the sense that if it's in the heart or in the brain, then you're getting heart or brain damage because you don't have enough energy for function. So then cells start programming for death because they are getting damaged.
So how do you know if you're metabolically inflexible?
I think looking at fitness levels would be good. Looking at blood biomarkers, looking at your fasted insulin, looking at your insulin resistance. Insulin resistance is a big, way to tell, is a very important way to tell whether someone is metabolically flexible or not. Because if your insulin resistance you are not metabolically flexible because your cells are not behaving the way it's supposed to. When you eat, you're supposed to bring in the glucose, and insulin's supposed to give the signal for your cells to bring in the glucose from the blood. But if you're insulin resistant, it's resisting that signal, and therefore your blood glucose remains high and your muscle cells remain starving. So for example, that's just one example, right? And then you can look at VO2 max tests, the ability of you being able to push your VO2 as high as possible. How possible are you to go from fat metabolism to glucose metabolism at what point?
Cravings and like just
Cravings for
day-to-day
sure. I think
things.
that's
Yeah.
like a much deeper, much more complicated
Right, because that's emotional
area,
as well. Yeah.
emotional, hormonal as well.
Yeah.
So when hormones are present, you're not just looking at substrate metabolism, right? You're not just looking at, I mean, granted, insulin resistance, the name itself, insulin is a hormone. So it is very much affected by the hormonal dysregulation and the dysfunction of those cells in metabolizing the substrate on top of everything.
So, Nat, how often do you go into ketosis?
Not often at
Not
all.
often.
So
Okay.
I've tried ketosis. I've tried keto diet, as I said, for about 2, 3 months at the beginning of my career at HVMN, and my body just doesn't like it because
Right.
I do lift weights in the gym, and when I lift weights, it just doesn't do it for me. But I do want the benefit of ketones. Like I said before we record, I took a shot of Ketone IQ. It
Yes.
gave me the mental clarity and ability to um, connect my mind and my mouth so that they
Mm.
are on the same pace and one is not tripping the other. And what I find most efficient for me is to still consume carbs so that I can get that powerlifting energy, that high intensity, short burst of energy. But with the ketone IQ on top of that, I can then enjoy the longer lasting endurance effect. So I can lift longer. I can go on a cardio machine after I lift and not feel like I'm lightheaded. So that is my sort of sweet spot. But it could also be a genetic factor where, growing up in an Asian country, we are always eating some form of carbs, either noodles or rice. So I think that sort of got programmed into
Yeah.
your
I
body. And that's
understand
why
that.
I always tell people glucose or carbs are not always the villain and fats are not always the villain. It
Mm.
is a balanced diet. It is when you eat a lot of sugar and a lot of fat. That's when you have excess of calories, and that's when you force your body to break down and dysregulate your hormones. So it's about getting a balanced meal, but also tailored to what your metabolism is, what your body needs and how you feel. Because a lot of times we tend to push away our subjective feel when we try a new diet, when we try a new like lifestyle change. And because we want our ego to be right so bad that we push away how our body actually is
You're so
responding
right
to it
about
and
that.
telling
Yeah.
us because we want to be right so bad.
Yeah. It's like when you're doing the keto diet, let's say, and you really want some carbs, but you're just like, no, I'm doing the keto diet, I'm sticking with it. And then the moment you have some carbs, you're like, oh, that's just what I needed. And then your
Yeah.
body just calms down.
Yeah.
So my husband at the moment, he's low carb at the moment because he wants to lose some weight.
Yeah.
And yesterday he said he had to have some carbs in the afternoon because he was just really craving it for days and he was just ignoring it. But then as soon as he had those carbs in the afternoon, he suddenly his body just settled and then
Yeah.
he could just carry on with his low carb diet after that. So I you're so right about that, like listening to your body signals. That's a great time then to go into exogenous ketones, which is what Ketone IQ is all about.
Yeah.
Exogenous ketones, I've used them a few times. I've tried Ketone IQ, and I have to say it tastes a little bit better than some of the other exogenous ketones. What is
We're
it?
still improving it. We're
You're
still
still
improving it.
improving it. What is it about the taste of ketones? Like, how is it it's so difficult to get a product that is because some people find it fine, some people find it intolerable. So
Yeah.
what is with that with
It is
ketones, by
just
the
by
way?
nature, the molecule
By
itself, it just
nature,
tastes
yeah, of course.
bitter. Some molecules just taste bitter, right? Some natural,
Yeah.
some amino acids taste very bitter, and some
I
amino
suppose it
acids taste
shows that it's the
sweet.
real deal. Like you're not
Yeah.
just putting in
Well,
anything
we
into a
used to joke
bottle.
around before we had all these flavors of like green apple and raspberry, lemonade, and peach. We used to joke that it tastes like it works, and people get it right away. You know.
Totally, yeah.
Yeah.
You
So
have it and you're like, oh God, like that must be
now you're awake.
working.
Now you're
Yeah.
awake. No, so all the things that we have talked about around ketones and ketosis and creating your own ketones, that's endogenous ketones. So
Mm.
ketones that you produce internally within your body. So what is exogenous ketones is essentially external source of ketones that you can directly take, like Ketone IQ, like this bottle or a shot of Ketone IQ that you can just drink it, and that will elevate your blood ketone levels. Now, the the benefit of that is that you don't have to go on a keto diet. You don't have to have a 1 week of fasting to get your ketone levels high. You can immediately see your ketone levels increase within half an hour. The drawback from that is that obviously, because it's an external source, after 5 to 6 hours, um, if you're working out, it will disappear faster. If you're not working out, it will last 5 to 6 hours, and then you have to either top up or you do it. So you will take it when you need it. So, in that sense, you are able to access the magic of ketones, we used to call it, without having to go through the grueling restrictions of diet.
So what is the magic then? So how is someone expected to feel when they take exogenous ketones?
Yes. So a lot of times we talk about ketones in terms of energy, and when people talk about energy, they straight away go to caffeine. I have to really caveat people to not compare it directly to caffeine, because caffeine is a stimulant. Ketone is not a stimulant. So caffeine will give you that jittery feeling, will give you that heart palpitation, it will increase your blood pressure. Ketone does not do any of that. In fact, in some cases, some people felt that their heart rate reduced when they work out on ketones. So they will be able to feel within 15 to 20 minutes a very calm, subtle way of focus. You suddenly feel like, wow, I can focus, especially if you're doing something, if you're meditating, if you're in a
Mm.
meeting, if you are on a podcast, you will be able to realize that the difference that it makes when you're on ketones versus when you're not. It's the level of subtle focus. I mean, you've taken it. Well, how would
Yes,
you describe it?
clarity. Like I would take it for clarity and for kind of almost like motivation. So I would do it pre-workout. And that's all for now. Like I don't do it any other time. I've heard that you take it before bed. I saw
Yes,
you on
I
a
do.
podcast. So I mean that's like and so your brain that just shows how calming it is to the brain because you take it before bed and does it
Yes.
help you sleep even?
It
Or do you
does.
do
It
it more
does.
for like ketones overnight, fat burning?
Well, you can do, but it gives you both. So a lot of athletes actually, they measure their Whoop recovery score. They actually improve their recovery score when they're on ketones before sleep. Some people can't take it before sleep because they feel like their brain is just racing. Um,
Really? Okay.
so I take it right before instead of like 1, 2 hours before. Because if it 1, 2 hours before, I'll be like, watching TV and then my brain start like imagining stuff. But if I take it right before bed, I go into deep, deep sleep.
Okay, that's a really good tip.
Yeah. And
So
also
and
another study did show
yeah.
that if you do vigorous exercise close to bedtime, you will affect your REM sleep as
Mm.
well as your adrenaline, noradrenaline, and dopamine secretion. But when ketones are present, it mitigates that damage.
So when should someone take, how often and when? should someone
I
take
think I
exogenous
think
ketones?
the best use case scenario is like the start of your day or like before any cognitively demanding tasks like I said, like meetings, interviews, podcasts, whatever. And pre-workout. Like
Mm.
those were the places where you would definitely feel the difference. And then you tailor it towards, what you need. You can use it post-exercise, you can use it before sleep. Some people use it before they go on a hike because it increases adaptation to hypoxia, and they can take it up to 30 grams per day. That's the FDA sort of guidelines around grass and about 30 grams to 35 grams per day. But we have athletes who have taken more than that because they are constantly burning it away,
Mhm.
and one really good way to ensure that you're not overtaking it is obviously just measure your blood ketones. You should always aim to have between like 1 to 2.5, that sort of optimal zone.
So someone can't take too much, would you say? Like, would you put a cap on how much someone would have in a day?
A
I mean, I can't
so
imagine someone would want to take it all many times a day because it's
in
quite
one
strong,
dose,
but
yeah, in one dose, I wouldn't recommend taking more than 30 gram in one
mm,
dose.
mm,
Okay. If you're talking about per day, we have had clinical studies. Now, these are clinical studies. They are taking like 100 grams a day,
wow.
three times a day. So 33 grams, 33 grams, 33
Yeah.
grams.
And
Um, and they're fine. And these are
yeah.
for heart failure patients. So
Mm,
they need that energy for the heart, and they saw an improvement in their cardiac output and all of that. So I would say no, a normal healthy person probably don't need that high of a dose,
mm,
but I usually take it about 50 grams a day because I'm
mm,
a heavier person. So a lot of these studies are also body weight matched. So 0.3 grams per kilogram of body weight is the guidance. So if
mm.
you are 60 kilograms, you would take 20 grams dose.
Well, thank you so much for being on this podcast. Like, it's so brilliant. Where can people find you?
Thank you so much for having me on as mine. And people can find me at Latt Mansor, LattMansor on all social media. And you can go to ketone.com to check out all the Ketone IQ stuff and the science and all of that too.
Okay, brilliant. Thank you so much.